Good afternoon. If you've just tuned in, where have you been? Now listen, despite more than 900,000 people in the UK living with heart failure, new research has revealed that over half of Brits couldn't identify the four main symptoms. Well, let me give you them. That's shortness of breath, swollen ankles, feeling unusually tired and dizziness. Now, the same study also revealed that two-thirds misidentified heart attack symptoms. Well, my first guest, Bev, had an out-of-the-blue heart attack 8 years ago and is diagnosed with heart failure. Bev, thank you for joining me here on GB News. Now, this is the thing. When somebody says they have a heart failure, I think that that's the end. I think that your heart's failed, you're not, you know, it kills you, but you're here and you've had it for 8 years. So can you explain what it is? Because my perception is obviously totally wrong.
Okay, like you said, shortness of breath is one of the main symptoms. I was diagnosed after having a heart attack. I didn't know I was having a heart attack. Was then diagnosed with heart failure, which I've never heard of, so I didn't know anything about it. You're short of breath, your body collects fluid, your ankles, your stomach, right up to your chest cavity, and you don't know what's going on. With me, my lungs filled up with fluid, was rushed into hospital after I'd been diagnosed, and that was drained off by the use of some medication. And as the years have gone on, you learn to live with it, but there is still, nobody knows what it is. When you say to people, I live with heart failure, they think you're going to keel over and die. That doesn't happen. It can be managed, but people do need to know what it is.
Exactly as you said, I just thought that if people had heart failure, then that means the heart has failed. So what is it about your heart that has failed?
I have a dead spot in my heart because I waited a long time before I looked for medical attention. So part of my heart died. It just means your heart doesn't pump as efficiently as the normal person.
And for you, how has it impacted your life since you had the heart attack and have been diagnosed with this condition?
It's changed my life considerably because you are no longer able to do things in the way that you once did. But with help, support, knowledge, you can adapt. You have to adapt the way that you function, but you can still function. You have a lot of challenges. I can't walk up a flight of stairs without losing my breath. I can't walk very fast for very long. If I do walk for 5 minutes, I have to stop and have a rest. But it doesn't mean that I can't do anything. You still can. Like I say, if you've got the right help and support around you, you can still function.
Pretty young, though, to me. So looking at you, I'm thinking, well, you look quite young. You look pretty healthy, in a sense. Can I ask, how old were you when you had your heart attack?
I was 50.
Wow. See, that's very young, you see.
I'm very young.
You are very young. You look fabulous for it as well. So, I mean, it's frightening then. So, and what was your lifestyle like? I mean, were you relatively fit and quite active?
I used to go to the gym 3 times a week. I worked a full-time job and a part-time job. I've just done things all the time, done things with my grandchildren and with my family. Obviously, afterwards, I had to slow down. It did take a good couple of years to get any sort of normality back. But it's back and it's here to stay. I refuse to let it keep me down, basically.
And in terms of medicine, do you take medicine daily to sort of keep it under control?
Yes, I take lots and lots of medicine. I take approximately 30 pills a day.
Wow.
Spaced out over 4 doses. You've got one to slow your heart down, one to make your blood pump, one to make your chamber fill. There's quite a range. It's out there and it can help you to rebuild your life. Your life, in some cases, your life will not be the same, but you still have a life and you can make it work.
Well, listen, Bev, thank you so much for joining me. And, you know, you're doing well. Keep up your strengths up. You're looking fabulous on it anyway. It's good to talk to you. Thank you so much. Well, let's carry on with this conversation because joining me now is consultant cardiologist Dr. Asim Malhotra. Now, Dr. Asim, are you surprised by these statistics, firstly, with regard to all this heart failure?
I'm not that surprised, actually, and I think it's important to reinforce the message around the symptoms that are you know, most common for heart failure, so people can recognise them. So normally it's shortness of breath is the most common. When people are doing activities, they might find they're getting out of breath, and that would be a warning sign. That's the most common symptom. The other symptoms are fluid buildup in the ankles, so people may notice that as well, or just feeling very fatigued. But the actual root causes behind them are also really important to highlight because the same risk factors, if you like, that drive heart disease, blockages of the arteries, are the same ones that drive heart failure. So things like high blood pressure, type 2 diabetes, excess alcohol, for example, can be one of them as well. And what most doctors, interestingly, and most cardiologists probably are not aware of, that the underlying root cause is something we called insulin resistance. So the science has evolved in our understanding of what drives heart failure. And what drives insulin resistance? Well, basically, it's a relation between the hormone insulin in the body being sort of increased in excess. And what drives that? High glycemic index carbohydrates and junk food and a lot of refined carbs and sugar, that kind of thing. And interestingly, there was one very fascinating study done a few years ago where they found that one type of heart failure called diastolic heart failure, which in the grand scheme of things is responsible for about 50% of heart failure, and heart failure affects 900,000 people in the UK. It's a big problem in America, estimated to hit around 8 million Americans by 2030, costing the American healthcare system about $70 billion. So this is a real burden on our healthcare systems. The diastolic heart failure is a stiffening within the heart as opposed to a weakened heart muscle, and that can also make you breathless and make people ill. And one study, coming back to it, showed that when people went on a low carbohydrate diet, within 4 weeks, Nana, they were able to reverse from the ultrasound scan of the heart the markers of diastolic heart failure. Now, it's one study and it's early stages, but we know the root cause of it. And I think when we think about the prevention side, we need to focus on fixing people's food, ultimately. We come back to the same conversation again and again and again.
And the thing is, I think it's quite recent, really, that doctors have really looked at food and acknowledged that it has a real impact. I mean, this is something that I study. I studied nutrition, and I've been into nutrition for many years, right? So to me, it's been obvious. And when I was a little while ago, maybe 10 years ago, diagnosed with something called lupus, and I changed my food and the way I eat, although I ate really well anyway. But when I went to my rheumatologist and said, well, this, that, and that's an inflammatory food, and he was like, oh, well, you know, it's not really, and kind of dismissed it.
That's
and that was
fascinating.
almost 10 years
and did
ago.
it help your lupus?
Oh, absolutely.
Well, it's very interesting you say that because we know a lot of autoimmune conditions are linked to diet, but just to try and give some defence or understanding to why your doctor may have been dismissive about it, we're not taught anything about nutrition in medical school. I mean, this is another topic, but most doctors know very little about it, and therefore, because they know very little about how it links to disease, chronic disease that's causing a lot of harm to our healthcare systems at the moment, then they don't have confidence to talk about it. But actually, it's not rocket science. You know, we have to really think about what we're eating, and the types of foods that are being marketed and being sold and people are getting really addicted to are the ones that are really ultimately toxic to the body and are linked to so many conditions.
Yeah, well, perhaps it's time that we doctors got educated on those things as well. But as a cardiologist, does that mean that you actually perform surgery on people's hearts?
Well, I mean, for most of my early career, that's what I did as an interventional cardiologist. So it was keyhole heart surgery. So I've seen it at the, you know, the end result of the harms of people's lifestyles. And of course, that inspired me to go down a journey in the last few years of prevention. So right now, I'm kind of trying to do my bit to improve medical education, but also to help introduce policy changes that really improve the environments that people live in, which derive the consumption of these sorts of junk foods.
Wow. So you have done open heart surgery before?
Well,
it's just in the keyhole stuff?
It's about keyhole. So there's two different... So that you can crack open someone's chest.
Do you think you could have done the open stuff?
If I was trained down that line, yeah. Wow. But I mean, the good news about heart disease, Nana, and that's something I do now because I manage people, obviously, in clinic environment. Most of heart disease can be both prevented and even managed just with lifestyle changes and with the right medications, with the right patients. Unfortunately, the way we have been managing heart disease for many, many years has kind of been a very sort of pharmacological